Why are virtual psychiatry licensure laws so complex? Imagine trying to connect a doctor and a patient across state lines, but hitting a maze of rules and regulations at every turn. That's what virtual psychiatry faces every day. Each state in the United States has its own set of licensing rules for mental health providers, including psychiatrists. These rules cover how they get licensed, what they can do, and how they must protect patient privacy. When a psychiatrist wants to provide care through telehealth, they need to be licensed in both their own state and the patient's state. That's because laws say they can only treat patients where they are officially licensed. This means a psychiatrist in California cannot simply see a patient in Texas without getting a license there first. Getting licensed in each state involves filling out separate applications, paying fees, and passing background checks. Each state has different requirements for education, experience, and exams. Some states requiring a full in-person exam before issuing a license. Others might have shorter processes, but it still takes time and money. For telehealth providers, this can mean applying for multiple licenses, which can take months and cost hundreds or thousands of dollars. States also have different rules about how telehealth sessions should be conducted. Some requiring patients to give written consent before starting telehealth. Others have specific rules about recording sessions or keeping records. When it comes to prescribing medication, especially controlled substances, rules get even stricter. Some states need an in-person visit before prescribing certain drugs remotely. Others allow virtual prescriptions if certain conditions are met. To make things easier, some states participate in licensure compacts. These are agreements that let licensed professionals practice in multiple states without getting a new license each time. The most common for mental health providers is called the Psychology Interstate Compact, or PsyPact. But not all states are part of these agreements, and some only allow certain types of providers to use them. For example, psychiatrists often cannot use PsyPact unless their state has adopted it, and they meet specific criteria. Behavioral health providers also face extra hurdles because of privacy laws. States have different rules about how mental health information must be protected. These laws influence how teletherapy sessions are scheduled, documented, and recorded. All these factors make the licensure process complicated and sometimes slow. This complexity can cause delays in getting patients the care they need. It can also make it harder for people in rural or underserved areas to access mental health services. For telepsychiatry to work smoothly, providers need to stay updated on each state's rules and be ready to handle licensing requirements. Telemedicine platforms often have tools to help with this, but it remains a challenge. In the end, the reason these laws are so complex is that states want to protect patients' safety and privacy. They want to make sure providers are qualified and that mental health information stays confidential. Balancing these concerns with the need for accessible care is what makes virtual psychiatry licensure laws so intricate. Staying compliant requires effort, but it's essential to ensure quality care across state lines.